Question 1. In the context of healthcare data interoperability, which of the following standards is primarily used for the exchange of laboratory test results and observations between systems? A. SNOMEDCT. B. LOINC. C. ICD-10-CM. D. CPT. Correct answer, B. LOINC. Explanation. LOINC, logical observation, identifiers names and codes, is a universal standard for identifying medical laboratory observations, facilitating the exchange and aggregation of clinical results across different systems. Question 2. Which of the following terminologies provides a comprehensive, multilingual clinical healthcare terminology that covers diseases, clinical findings, procedures, and outcomes? A. ICD-10-CM. B. SNOMEDCT. C. HCPCS. D. NDC. Correct answer, B. SNOMEDCT. Explanation. SNOMEDCT, systematized nomenclature of medicine, clinical terms, offers a detailed and comprehensive clinical terminology, enabling consistent representation of clinical content in electronic health records. Question 3. Dr. Thompson is implementing a new electronic health record (EHR) system in his clinic. He wants to ensure that the system can effectively communicate with external laboratories and imaging centers, allowing seamless exchange of patient test results. Which data standard should Dr. Thompson prioritize integrating into his EHR system to achieve this interoperability? A. ICD-10-CM. B. LOINC. C. CPT. D. RX norm. Correct answer, B. LOINC. Explanation. LOINC is specifically designed for the electronic exchange of laboratory and clinical observations, making it essential for interoperability between EHR systems and external diagnostic services. Question 4. In healthcare data management, what is the primary purpose of a data dictionary? A. To store patient health records securely. B. To provide a standardized set of definitions for data elements. C. To encrypt sensitive patient information. D. To schedule regular data backups. Correct answer, B. To provide a standardized set of definitions for data elements. Explanation. A data dictionary ensures consistency and clarity by defining the meaning, format, and usage of data elements within a database, which is crucial for data quality and interoperability. Question 5. Which of the following best describes the concept of master data management, MDM, in healthcare? A. A system for managing patient appointments. B. A process for handling billing and claims. C. A framework for ensuring consistent and accurate core data across systems. D. A method for encrypting patient data. Correct answer, C. A framework for ensuring consistent and accurate core data across systems. Explanation. MDM involves the processes and tools that define and manage the critical data of an organization to provide a single point of reference, ensuring data consistency and accuracy across various systems. Question 6. Ms. Garcia is a data steward at a large hospital. She notices discrepancies in patient demographic information across different departments, leading to challenges in patient care coordination. To address this, she decides to implement a system that ensures uniformity and accuracy of core patient data across all departments. Which approach should Ms. Garcia adopt? A. Implementing a new billing system. B. Developing a master data management (MDM) strategy. C. Upgrading the hospital's firewall. D. Conducting staff training on data entry. Correct answer, B. Developing a master data management (MDM) strategy. Explanation. An MDM strategy will help standardize and synchronize patient data across various systems, reducing discrepancies and improving data quality for better patient care coordination. Question 7. Which standard is primarily used for the electronic exchange of healthcare information, including clinical and administrative data? A. HL7, B. ICD-10-CM, C. CPT, D. NDC. Correct answer, A. HL7. Explanation: Health Level 7, HL7, provides a framework and standards for the exchange, integration, sharing, and retrieval of electronic health information, facilitating interoperability between healthcare systems. Question 8. What is the primary function of the RX norm, standard in healthcare data? A. Classifying medical procedures. B. Standardizing drug names and formulations. C. Coding diagnostic tests. D. Managing patient demographics. Correct answer, B. Standardizing drug names and formulations. Explanation: RX norm provides normalized names for clinical drugs and links them to many of the drug vocabularies commonly used in pharmacy management and drug interaction software, ensuring consistency in drug information. Question 9. Mr. Lee is integrating various clinical systems within his healthcare organization to improve data sharing and patient care. He wants to ensure that medication information is consistently represented across these systems. Which standard should Mr. Lee implement to achieve this goal? A. ICD-10-CM, B. SNOMEDCT, C. RX norm, D. LOINC. Correct answer, C. RX norm. Explanation: RX norm standardizes drug names and formulations, facilitating consistent representation and exchange of medication information across different healthcare systems. Question 10. In the context of healthcare data standards, what is the primary purpose of the CPT coding system? A. Classifying diseases and health conditions. B. Coding laboratory test results. C. Describing medical, surgical, and diagnostic services. D. Standardizing drug names. Correct answer, C. Describing medical, surgical, and diagnostic services. Explanation: Current procedural terminology, CPT, codes are used to describe medical, surgical, and diagnostic services, facilitating billing and documentation in healthcare. Question 11. Which of the following best describes the purpose of data stewardship in healthcare? A. Managing financial transactions. B. Ensuring data quality and governance. C. Overseeing clinical procedures. D. Conducting patient surveys. Correct answer, B. Ensuring data quality and governance. Explanation: Data stewardship involves the management and oversight of an organization's data assets to ensure data quality, integrity, and compliance with governance policies. Question 12. Dr. Patel is concerned about the accuracy and consistency of patient data across multiple departments in his hospital. To address this, he appoints a team responsible for overseeing data quality and implementing governance policies. What is the role of this team? A. Financial auditing. B. Data stewardship. C. Clinical research. D. Patient outreach. Correct answer, B. Data stewardship. Explanation: The data stewardship team is responsible for ensuring the accuracy, consistency, and proper governance of data across the organization, which is essential for effective healthcare delivery. Question 13. Which coding system is primarily used for classifying diseases and health conditions in healthcare? A. CPT. B. ICD-10-CM. C. LOINC. D. RX norm. Correct answer, B. ICD-10-CM. Explanation: the International Classification of Diseases, 10th Revision, Clinical Modification, ICD-10-CM, is used for coding and classifying diagnoses and health conditions in healthcare settings. Question 14. In a hospital's quality improvement analysis, analysts noted a significant drop in patient satisfaction scores. To assess whether the difference is statistically significant across time periods, which statistical test would be most appropriate for comparing the mean scores from two different time periods? A. Chi-square test. B. One-way ANOVA. C. Independent samples t-test. D. Logistic regression. Correct answer: C. Independent samples t-test. Explanation: an independent samples t-test compares the means of two independent groups, e.g., two time periods. It is ideal when evaluating if the change in patient satisfaction is statistically significant. Question 15. A healthcare analyst is examining a dataset with patients' age, BMI, and whether they were readmitted within 30 days. To predict readmission likelihood based on these factors, which model is most suitable? A. Linear regression. B. Logistic regression. C. One-way ANOVA. D. Chi-square test. Correct answer: B. Logistic regression. Explanation: logistic regression is appropriate for binary outcomes, e.g., readmitted, yes, no, and allows modeling the effect of independent variables on the likelihood of a categorical dependent variable. Question 16. Ms. Avery, a hospital data analyst, is reviewing a new intervention program designed to reduce hospital-acquired infections, HAIs. She compares infection rates before and after implementation across 3 hospital departments. She also wants to know if the intervention had different effects across departments. What is the most appropriate method for her to use? A. One-way ANOVA. B. Paired t-test. C. Two-way ANOVA. D. Simple linear regression. Correct answer: C. Two-way ANOVA. Explanation: a two-way ANOVA allows Ms. Avery to analyze the effect of two independent variables, time period and department, on the infection rate and whether their interaction is significant. Question 17. What is the primary reason for using confidence intervals, CIs, when reporting the results of a study? A. To determine causality. B. To measure central tendency. C. To estimate the precision of the sample statistic. D. To test for normality. Correct answer: C. To estimate the precision of the sample statistic. Explanation: confidence intervals provide a range within which the true population parameter is likely to lie and convey the reliability of an estimate. Question 18. Which statistical method is most appropriate to assess the association between two categorical variables, such as gender and disease status? A. Linear regression. B. ANOVA. C. Chi-square test. D. Pearson correlation. Correct answer: C. Chi-square test. Explanation: the Chi-square test assesses whether there is a significant association between two categorical variables. Question 19. Mr. Benson is evaluating the success of a predictive model that forecasts which patients are at high risk of being readmitted within 30 days. He wants to measure the model's performance by examining true positives and false positives. Which metric should he focus on? A. R-squared. B. Precision and recall. C. Mean squared error. D. Confidence interval. Correct answer: B. Precision and recall. Explanation: precision and recall are key metrics for evaluating classification models, especially in healthcare, where the cost of false positives and false negatives is critical. Question 20. In predictive modeling, What does the area under the rock curve AUC represent? A. The likelihood the model underfits the data. B. The goodness of fit of a linear regression. C. The probability the model will correctly classify a randomly chosen positive instance. D. The mean difference between predicted and actual values. Correct answer: C. The probability the model will correctly classify a randomly chosen positive instance. Explanation: AUC measures the ability of a model to distinguish between classes. A higher AUC indicates better discriminatory power. Question 21. Why is feature selection critical in building healthcare predictive models? A. It decreases software costs. B. It avoids privacy violations. C. It improves model performance and prevents overfitting. D. It replaces the need for data normalization. Correct answer: C. It improves model performance and prevents overfitting. Explanation: feature selection reduces the number of input variables to those most predictive, enhancing model generalizability and interpretability. Question 22. Dr. Rao is developing a risk adjustment model for a chronic disease management program. His dataset includes variables like age, income, comorbidities, and hospitalization frequency. Which modeling approach should he use to account for continuous and categorical variables and estimate patient risk? A. Decision trees. B. Logistic regression. C. K-means clustering. D. Simple linear regression. Correct answer: B. Logistic regression. Explanation: logistic regression handles both categorical and continuous predictors and is widely used in healthcare risk prediction due to its interpretability and effectiveness. Question 23. What is the primary purpose of the Case Mix Index, CMI, in hospital finance analytics? A. To measure the hospital's patient satisfaction. B. To track the number of patients admitted. C. To represent the average diagnosis-related group, DRG, weight and clinical complexity. D. To calculate nurse-to-patient ratios. Correct answer: C. To represent the average diagnosis-related group, DRG, weight and clinical complexity. Explanation: CMI indicates the relative complexity and resource usage of patients treated in a facility, impacting reimbursement under DRG-based systems. Question 24. Which metric is most relevant for analyzing the efficiency of claims collection within the revenue cycle? A. Readmission rate. B. Denial rate. C. Patient wait time. D. Average length of stay. Correct answer: B. Denial rate. Explanation: the denial rate measures how many claims are rejected by payers, affecting revenue and pointing to inefficiencies in billing and documentation processes. Question 25. Ms. Cheng, a revenue cycle analyst, is assessing the time it takes for her organization to collect payment after a claim is submitted. She notices a trend of increasing delays. What metric should she analyze to understand this performance issue? A. Cost per procedure. B. Days in accounts receivable, AR. C. Gross margin. D. Utilization rate. Correct answer: B. Days in accounts receivable, AR. Explanation: days in AR indicates the average number of days it takes to collect payment, and rising numbers suggest inefficiencies in billing or payer response. Question 26. Which of the following best defines bundled payment models in value-based care? A. Payments made per patient per year, regardless of service. B. Payments made separately for each test or procedure. C. A single payment covering all services during an episode of care. D. A reimbursement model based solely on outcomes. Correct answer: C. a single payment covering all services during an episode of care. Explanation: bundled payments incentivize coordinated care by providing a fixed payment for a full episode, encouraging cost efficiency and quality. Question 27. In capitation reimbursement models, what is the primary financial risk to healthcare providers? A. Underpayment due to incomplete claims. B. High administrative costs. C. Overutilization of fee-for-service procedures. D. Providing care for high-cost patients under a fixed payment. Correct answer: D. Providing care for high-cost patients under a fixed payment. Explanation: capitation provides fixed payments per patient, so providers assume financial risk for covering care that may exceed that amount. Question 28. Mr. Delgado, a financial analyst, is evaluating contract performance between a health system and a private insurer. He finds discrepancies between expected and actual reimbursements. To resolve this, which analysis technique should he apply? A. Predictive modeling. B. Root cause analysis. C. Risk stratification. D. Cohort analysis. Correct answer: B. Root cause analysis. Explanation: root cause analysis helps identify underlying reasons for financial variances, such as coding errors, contract misalignment, or delays. Question 29. What is the primary purpose of using relative value units, RVUs, in reimbursement? A. To calculate malpractice risk. B. To assign severity levels to patient outcomes. C. To determine provider compensation based on work effort and complexity. D. To track hospital-acquired infections. Correct answer: C. To determine provider compensation based on work effort and complexity. Explanation: RVUs quantify the value of physician services by considering time, skill, and intensity, forming the basis for Medicare and many private payer reimbursements. Question 30. Why is risk adjustment critical when analyzing outcomes in value-based reimbursement? A. It guarantees higher reimbursement. B. It standardizes drug formularies. C. It accounts for differences in patient populations when comparing performance. D. It ensures claims are processed faster. Correct answer: C. It accounts for differences in patient populations when comparing performance. Explanation: risk adjustment compensates for varying patient complexity, ensuring fair comparisons of provider performance in value-based payment models.